Hey everybody, it's Dr. Brace here. Welcome to Facial Plastics Friday. Today we're going to talk about otoplasty. So an otoplasty is a surgery to reshape the ears. For most people, the issue with the ear is that this portion here, the antihelix, is unfurled, so it's flat and the ear sticks out. And what we do to fix that is put sutures underneath the skin through the cartilage to recreate that bend. This is called the antihelix, and that bend will pull the ear back. Another common problem with the ears that people dislike is that the conchal bowl, so this part here is too big and the ear sticks out from the bottom. And in that case, what we can do is remove some of the cartilage from the conchal bowl through an incision at the back of the ear and set the cartilage back with an incision to basically the skull, the mastoid bone. It's called a Furness suture, and pull the ear back here. And in some cases, we have to combine both Moustache sutures, which are the sutures in the antihelical fold to recreate it, and Furness sutures with some cartilage excision to set the ear back. That would be the most common procedure done to reshape the ears in an otoplasty, Moustache sutures or Furness sutures. But there's also some other techniques in otoplasty where we can change the shape of the earlobe. We can change the height of the scaphoid fossa, which is right in here. If somebody has a Darwin tubercle on their ear, that can be excised. And so an otoplasty can come in multiple different variations depending on what bothers you about your ears. Revision otoplasty is not uncommon in my practice. Sometimes people will have had an otoplasty in the past and will not be happy with the way their final ear position came out, and so we can often revise it and change it for them. Sometimes it's very easy. Sometimes there's just a little bit of skin that has to be excised from the back of the ear, and just the skin excision itself will pull the ear back without needing any cartilage incisions. So otoplasty is covered by OHIP until the age of 18, and after that it's not, and it's considered a cosmetic procedure. The great thing about otoplasty is you can do it under local anesthetic as an adult, and you can have a mirror and you can have say in what position your ear will be in at the end. And so I can do all the work behind your ear and get your ear in position, and you can look in the mirror and say, yeah, I like it there, or can you pull it back a bit more or not so much, and have a say on what your ears look like rather than it be a surprise after surgery. So if you have questions about otoplasty, send them our way. Here are some pictures of a patient I saw recently who's post-op from an otoplasty, and you can see how the ear has been reshaped and tucked back to a more natural position. Usually the ear should be about 2 centimeters from the skin of the scalp, the top of the ear, and so that's what we're aiming for, unless someone has a specific desire for that to be different. Hope everyone has a great weekend, enjoy this weather, and happy Facial Plastics Friday.